You guys so soft. You guys so soft.
Carrie Rigby Wilcox remembers her last conversation with her son.
He puts the gun out in the air and he shoots it 2 times. He says, "Mom, this is real. This is real, Mom. I'm done. I can't do it anymore."
On December 22nd, 2018, Stephen Rigby died. Police shot him after he fired his own gun in the air on a stretch of road outside Saskatoon. His mom believes it was deliberate, the final act after months of escalating suicidal behavior.
A vehicle's coming towards us, and here it's Stephen, and his tires pop. That's the last time I've seen my kid.
She believes it could have been prevented. Just a few days earlier, Rigby was in hospital. His mother obtained his medical documents. This discharge form from the Dubé Center, a mental health clinic in Saskatoon, shows that at 3:30 on December 20th, he left. It shows the prescription was to be checked with the patient and his family on discharge, and it lists his mother as his primary contact.
I get a text saying of one of his friends, "Stephen's not at Dubé." And I'm like, "What?" He's like, "He's not at Dubé."
His admittance form from 2 days earlier shows his family brought him in just before 6 p.m. Rigby Wilcox says she asked staff to let her know how he was doing.
I phoned RUH Dubé myself. I said, "I would like to know if Stephen Rigby is in your facility." They said, "Sorry, patient confidentiality."
His assessment, one day after he was admitted, lists a previous suicide attempt, hallucinations, and says he was admitted to another hospital for the same reason months earlier. And it states he also made comments wishing to kill himself recently, though he minimized those. This form shows he was admitted involuntarily and certified, yet he left.
I said, "I need to know if my son is going to kill himself tonight or not." And they said, "1 minute, please." He was released at 3 o'clock.
She did find him and he returned to her house. 2 days later, he left. She heard from his friends he was texting them goodbye. It was similar to another time he was hospitalized in North Battleford that August at 5:15 p.m. In every question, he said he wanted to kill himself and he was deemed a high suicide risk. The writing on the form is Rigby Wilcox's.
Within 45 minutes of being at North Battleford Hospital, they discharged him with more medication.
His family brought him back a few hours later.
It's for you.
Rigby Wilcox says she tried to help in any way she could, and she says her son wanted her involved in his treatment, but she was shut out because he was 27.
Why can't I be in there when my son wants me to be in there to listen, to help with this?
It was the same for Marilyn Irwin and her 38-year-old son, MacRae.
I was told lots he's an adult. He can make his own decisions, even though he would invite me into appointments with him. It was no, it's up to him, which is fine if you're able to make a decision that's that doesn't jeopardize safety to him and the community.
MacRae also died by suicide after battling mental illness and substance abuse, and he also repeatedly interacted with the province's healthcare system.
He thought there was somebody in the garage next door, so he went to his neighbors, they lives like right beside, and knocked down their or kicked the garage door.
Police arrested the father of 2 in 2018 with a gun. From that point on, he was in a private treatment center in BC that cost his family more than $15,000, as well as Saskatoon ERs and Narcotics Anonymous meetings.
His curfew and stays with me and goes to meetings and goes to whatever appointments he has. And he asked me to attend some of them with him, which I do.
But she was also shut out.
I mean, are you fully aware, I guess, of his diagnosis and his treatment?
No. I never really understood fully what was going on. And it was kind of like piecemealing.
MacRae's mental health got worse. He started using again in September, and his family brought him to the ER.
I had to get on the phone and ask for assistance from a counselor because he didn't want to stay. And I said, well, what can I do? And they said, there's nothing you can make him do. And so when he wanted to leave, then he left.
Irwin says he was released shortly afterwards, and not long after that, he tried again to take his own life.
One of the strange things for myself is that he's going to school during this time and attending school, and later I find out he's passed some of his classes.
MacRae died by suicide on May 1st, 2018.
He just didn't care anymore. Like, to get to that place, I think it's a hard thing to describe to someone where you have no hope.
Irwin and her ex-partner wrote several letters to his family doctor asking for him to be admitted. After he died, she wrote another one to the College of Physicians. In his response, the family doctor says he does not have admitting privileges to the hospital. He could mandate an involuntary assessment, but he did not believe MacRae met the criteria for involuntary treatment. Irwin, like Rigby Wilcox, fought for her son, and she says she could have done more if she knew more.
I think we need to be more fluid with that and more fluid with individuals' medical needs.
This doctor says it's very complicated.
If someone's truly motivated to die by suicide, there's probably not a lot that we can do to prevent it.
Dr. Tyler Black practices and studies suicide prevention. He estimates he sees around 1,000 children a year in crisis. He says treating someone who wants to kill themselves isn't as simple as taking away sharp objects.
Even if we were to hold them for a few days, they can say and act and do enough to get discharged and enact their plan.
There are strict conditions for keeping people against their will for treatment. Most of the time, patients need to consent to stay, and they can revoke that consent. Black says the patient needs to want to get better, so a crisis isn't the best time for treatment.
We're our least effective when people are in their most crisis moments. We're probably in our most effective when we're able to prevent these things from occurring.
Proper suicide prevention, Black says, is a societal issue that recognizes it can be driven by a variety of factors, from relationships to addictions. And he says it does involve families, in a voluntary capacity, to help support patients, especially during high-risk times like admissions, transfers, and discharges.
If a person has indicated that they want their family to be involved, it's really important for hospitals to take that seriously when discharge is being planned.
Global News contacted the Office of Mental Health and Addictions Minister Everett Hindley for an interview on this. They said he wasn't available and directed us to the Saskatchewan Health Authority, who directed us to a statement from 2021. It's a response to the inquest into Stephen Rigby's death, which, among other things, recommended increasing the annual training spots for psychiatrists. The response said capacity is communicated to leadership at the College of Medicine, who work with the Ministry of Health to identify priorities and negotiate funding for residency training spots.
Overburdened healthcare systems because of the pandemic over the last couple of years. So we're working pretty hard to make sure that we're recruiting more healthcare providers in this province, that we're incentivizing those ones that are here and that are coming here to help retain them in our province, and also training them as well.
In another statement, the SHA said legislation does not allow for the disclosure of personal information unless the adult child consents to such disclosure. Irwin and Rigby Wilcox are still living with their grief, an inescapable reality when you lose a child.
I struggle with my mental health every day, and I kind of find it funny that nobody's checked in on me.
They hope the province helps families before they suffer the same way.